Role of abdominal pressure during colonoscopy. Parts of the colon that need abdominal pressure include: first part is sigmoid colon, second part is transverse colon, which have persistent mobile mesentery, so the passage of the colonoscope is difficult due to mobility in abdominal cavity. Factors that affecting colonoscopic procedures: effective colonic preparation, previous surgeries, physician experience, abdominal pressure by experienced assistant. Effective and safe abdominal pressure by assistant during colonoscopy is critical in assisting the physician to reach the cecum. A good place to start pressure is in the sigmoid area, commonest area of colonoscopic looping. If the scope is not advancing, the assistant need to reposition of his or her hand, then try to advance the scope. Techniques of abdominal pressure during colonoscopy. There are 3 techniques. Open hand technique: palm of the left hand and the fifth finger placed parallel to the pelvic bone and the patient on the left side, as seen in the first image. Second technique of abdominal pressure is single forearm technique, brachial pressure. Place the left hand as follows: palm down, fingers extended, knuckles down or in a fisted position under the patient in the area of the sigmoid colon, and the assistant rolls his forearm into the patient. Third technique is 2 forearm technique with counter pressure. The assistant uses both forearms to provide pressure when we need more pressure to broader area to move the scope forward. This pressure considered light with the exception of the obese patient. The patient needs to be positioned within 25 to 50 centimeters of the person applying pressure to the abdomen. This allows the arms to be more effective posture with the whole body more involved, not just the arms and back. Several key factors are important when applying abdominal pressure. First one, be aware of the amount of pressure needed to keep the lumen patent and not to injure yourself or the patient. Second factor, open hand technique leaves the assistant more vulnerable to possible wrist injury. Third key factor, good body mechanics and positioning should be used to ensure optimal comfort for the patient and the assistant. Fourth key factor, using both forearm technique allows the assistant to provide effective and safe abdominal pressure, decreasing the risk of the patient injury.